Gastroenterologist, Dr. Fadi Alali. Welcome to the show.
Thank you.
I've been all day long trying to say gastroenterologist. Did I get it right?
You did.
It's a big word.
It is.
So what is it? What is a gastroenterologist?
So gastroenterologist is a subspecialty of an internal medicine. We basically focus on the GI system, including the esophagus, stomach, small intestine, large intestine. That includes also liver disease, includes also inflammatory bowel disease. So it's a huge field of medicine that takes care of the digestive system.
And everybody should be concerned about it.
Yes, absolutely.
Now you want to let people know that colon cancer can be prevented.
Yes.
And we should all be aware that it's a risk for anyone, but at what point, maybe at what age is it a bigger risk?
So that's a very good question, because colon cancer used to be a cancer at the ages of 60s, 70s, and 80s. But very interesting that over the last few years, we've noticed increased incidence of this cancer in the younger population, in the ages of 20s all the way to 49. And for that reason, the U.S. Preventive Service Task Force, as well as the gastroenterology societies and also the Oncology Society, decided to move the screening age from age of 50 to age of 45 to try to capture the younger population who is at risk for this colon cancer. And it's very scary because, this incidence at this younger age, it goes up 1 to 2% each year. So, the expectation in 2023, we will have a good number of younger patient who is having that colon cancer. And that's why we have to focus on this, prevention and then on the screening for this cancer.
Why do you think people are getting colon cancer at a younger age?
So many different, risk factors, including family history, including, environmental, exposure, smoking, health risk factors, including obesity. The increased incidence of obesity definitely is a high risk factor for colon cancer. Also, the diet, the food, the increased red meat, increased processed food. These are all, risk factors for colon cancer.
Diet.
Yeah.
So it used to be 60 or so get a colonoscopy. Now
45.
Wow. And how often?
So how often all depends on your risk factors, okay? So, and then also depends on the modality, because we are lucky that we have more than one modality of colon cancer screening. We have the colonoscopy, we have the stool-based test, we have imaging including CT colonography, or we have what we call the flexible sigmoidoscopy, which is a partial colonoscopy, and then get combined with another stool test called the FET test. So the main thing is, my advice for the patient is to sit down with their physician and to decide on what is the best screening method they want to go with. If we're choosing a stool test, some of them get done every year. The others the Cologuard or the stool box test every 3 years. But for the colonoscopy, if you are at average risk and you don't have any higher risk than the general population, it's every 10 years based on the results of the colonoscopy. So if I do the colonoscopy and there's no polyps at all, then you are every 10 years. But you have to also keep in mind, it has to be a good quality colonoscopy. It has to be a good bowel prep. It has to be a complete colonoscopy all the way to the beginning of the colon, which is the cecum, done by an experienced physician with a very high rate of detecting polyps, because that matters. So if we achieve all of these factors, then you're really good for 10 years.
Oh, wow.
And that's the good thing when you compare a test that's done every 10 years with a test that's done every year or every 3 years. The problem with the difference between the colonoscopy, you can find polyps, and you take the polyps and you prevent the cancer. The stool tests are mainly designed to find the cancer. Okay, their detection rate for the polyps is lower than probably in the 40s to 50%. So not ideal to capture polyps, but they're good to capture early colon cancers.
All right, so I feel good now because you guys told me about a month ago. We'll see you back here in 10 years.
There you go. There you go. Then you did a great job with this.
Yeah, I think I did a great job. And really, the patient does have to do a lot of work for the colonoscopy. It's the prep.
It is the prep.
The dreaded prep. Now, you changed your field, changed the prep recently. There's a new prep, right, on how.
So there are different options for the bowel prep. Okay, there are options. We have tablets. We have the solutions, which is the Golightly. We have the other options of the Miralax you mix with the Gatorade. You just have to talk to the doctor and then see which prep you can stick with. Okay, and then also some other risk factors can play a role. So if a patient has a kidney function, they may not qualify for for the Miralax with the Gatorade. They will be probably better with the Gatorade with the Golightly. So all depends on what the patient prefer and what are the risk factors and other comorbidities.
It's not as bad as everyone tells you.
No, it's not bad.
It's not as bad as having colon cancer.
Exactly, exactly. Yeah.
Now, a polyp, is a polyp a cancer of itself?
So a polyp is a growth. It's a growth of the lining of the colon. Okay, this growth, it can be completely benign or can be benign precancerous. Okay, and that's usually grow into cancer if it's left alone. Okay, not resected.
All right, let's talk about these risk factors: the environment, the diet, all that. But what if we have family history? Because you asked the question, do you have a family history of colon cancer?
Yes.
Is it likely that is something that is part of your heredity?
So that's a very important question because 15% of colon cancers are related to family history and genetics. So in this case, I really encourage our primary care colleagues to start investigating and asking about the family history even at the younger ages. Even with their patients, every physical, when the patient come in their 20s, okay, they should start asking about the family history because the family history can change. If this year they have normal family history, next year they may have another relative that has colon cancer, and that can change the strategy on how to screen these patients. Also, it's the patient's responsibility to share this information with their loved one. Because if a patient diagnosed with colon cancer or an advanced polyp or large number of polyps, they should share this with their relatives, especially the first-degree relatives, because they can save their life if their relatives knew about their risk factors, so they can start at earlier age. So if you have family history, especially at ages younger than 60, they can go with at age of 40 to start screening instead of age of 45. They can go at age less than 10 years from where the relative was diagnosed. So that's many rules play here to capture these cancer earlier.
What kind of diet should people be on that would be minimize the risk for colon cancer?
I would probably suggest cutting down on the red meat. Okay, try not to avoid red meat more than twice a week. Try to avoid ultra processed food, because the problem with the ultra processed food is it's not only causing obesity, which is a risk factor for colon cancer, it also can enhance the inflammation in your bowel there, and that can lead to autoimmune bowel disease, and that can also be a higher risk for colon cancer.
Should people consider getting an endoscopy at the same time? If someone's calling in to find out if they should get a colonoscopy.
Not really, unless if you have any other risk factors, or if you have a family syndrome for polyposis, then definitely an endoscopy is indicated based on the syndrome that they have. So patients who have high number of polyps, or suspicion for any polyposis syndrome, they should go through some genetic testing to find out, and in this way we can also screen their relative, their first degree relative, to see if they have it or not.
Talk to your doctor.
Yes.
Talk to you.
Absolutely.
All right. So people you find cancer.
Mm-hmm.
Is it treatable?
So it is treatable. It is treatable, but I mean the prognosis and overall survival all depends on the stage when you catch this cancer. Okay, when you go to a stage 4, when the cancer is going somewhere else beyond your colon, the chance is way lower. So our goal is to catch it as early as we can to save this patient's life.
We see on the internet these ads. Oh, you can do a colon cancer test at home. What do you think of those?
Well, that's what the stool test, the Cologuard, which is a good test. Okay, we always, like during our GI meetings, like gastroenterology meeting and conference, we always say the best test the test that gets done. So we should not force our patient just to have the colonoscopy. We want them to do the test they can maintain and then continue doing it in the future. So and then do it in the right way. So going for a colonoscopy when they're not ready for for a bowel prep and you end up with poor prep, this is not the best test. Okay, so the test, if they can do a stool test and they can maintain this on a regular basis, then let it be. Okay, they just need to know, if they qualify for the stool test or not. If they have a family history, they're not a fit for a stool test. If they have polyps before, they should not have stool test. If they have positive tests before, don't even try to repeat the test again, because once it's positive, you should just stick with colonoscopies.
All right. Dr. Alali, what about fiber, probiotics? What do you think about those kinds of things, gut health? Do they have an impact?
So definitely, fiber, it's very healthy for the bowel to have. We always recommend 20 to 25 grams of fiber on a daily basis for patients to help regulate their bowel movement. Patient gets sometimes scared if they try fiber, they will have diarrhea. Indeed, like fiber will help regulate and form their stool, definitely. Probiotic, we don't have strong evidence on the use of probiotics against colon cancer so far.
All right. Well, if you have any concerns or questions, Dr. Alali is the gentleman to call, and you guys recommend that the colonoscopy should be done at an earlier age.
Yes.
If you're at that earlier age, get it going. Get going with it. Don't delay.
Yep.
Well, thanks for coming in, and hopefully we help people avoid cancer and catch it if anyone has it early.
Thank you, and thank you for having me.
You bet. Good to see you. Thanks for coming in.
Thanks.
Dr. Fadi Alali is a gastroenterologist at Henry Ford Jackson Hospital. Well, that's it. We've run out of time. Thanks to Dr. Alali and all our guests on the show today. The morning show and the Bar Holly show are going to be out for a few days, but we've got some of the best of coming your way over